I don't know. The guy clearly means well, but again, it's just a matter of being like condescending. Yeah, it didn't help at all. Like, just treat trans people like we treat anybody else. Like, it's really not that hard, guys. It's really not. So we have another video from a smaller YouTuber, which I wanted to go over because it came up on my front page and it just looked interesting to me. And I think that a couple of things that I saw at the very I pre-watched like a minute of it, right? And I think a couple of things that I saw in the first minute were a little bit misguided. Specifically, this YouTuber is called The Danish Male Nurse. The video is called Gender Identity versus Biological Sex, The Surprising Truth. Now, I don't think, from what I can tell, I don't think that this person is like ill-intentioned, right? I think that this is very much trying to help people who are struggling with gender dysphoria, their gender identity, whatever. And this person has good intentions. I'm going to assume that going in. My contention with the first part of the video is that he kind of messed up while there are only two sexes and didn't really dive into the sex spectrum. So we'll talk about that as well as some other things that I want to clarify because this is their most viewed video. It's 636 views, not that much, but you know, I just wanted to give my 2 cents on it. That's all. This guy looks oddly familiar. I couldn't say why. All right,
in
let's take a look.
healthcare, there's a fine line between respecting how people identify and recognize themselves and the reality of genetics.
So right off the bat, we have an incorrect statement. Transgender people do not typically believe that they have genetics that would lead them to being like the biological sex that they were not assigned at birth, the opposite of that which they were assigned at birth, right? Like there's no question in their mind as to whether or not they were born male or female. The question is whether or not they currently are a man or a woman, right? Does that make sense? Here, let me fix his subtitles real quick. I just think that there doesn't have to be a line between that. You can reconcile both.
It's the question we're facing today. As nurses, how do we balance honoring gender identity while knowing that biologically there are only two sexes?
So once again, this is what I mentioned in the beginning. There's not really just two sexes, quote unquote. There are even like different sexual genes that you can have. I think it's like XXY. You can have XXXY, upwards of like 4X chromosomes. So there's like technically like 6 different sexual variations you can have or something like that. And there's like this whole spectrum of things in between that happen extra genetically. Like, so like things that don't involve your genes necessarily, like hormone imbalances, things like that.
Can we do that, though, ethically speaking?
It is not about erasing anyone's experience.
Okay.
It's about providing the best possible care based
I should also mention, by the way, for those who don't know, I'm also a nurse. So like I'm coming at this from a nurse's perspective.
on the realities of human biology. Let's dive straight in. We live in a time where the gender identity has become a deeply personal and important part of who people are. More and more individuals identify outside of the traditionally binary of male and female. And it's vital that we as healthcare providers show respect and understanding towards those identities. In fact, it's our duty to treat each patient with the dignity and provide compassionate care, no matter how they identify. But here's where the challenge comes in. While we can and should respect gender identity, the fact remains that genetics, the DNA we are born with, tells a different story.
No, again, this is where my concern is. Like I said, he's not a bad guy by any stretch, but he does have a misunderstanding of what's happening here. Genetics do not tie into what gender you are. That is an artificial construct of human creation. So like we decided that that you're a man if you're an adult and born with a penis and have certain, the XY chromosomes, things like that. And you're a woman if you were born female, right? And are an adult.
From a biological perspective,
so you don't have to make that line.
Two sexes, male and female. These two sexes are determined by the presence of either XY or XX chromosomes.
Right, let's look real quick. And I'm not like getting an epic dunk or anything. I just want to clarify this. Sex chromosome aneuploidy. So here are the variations. There's 1, 2, 3, 4, 5, 6, 7, 8 of them. 9 of them, sorry. Actually, 11 total if you count the original XXXY, the OGs, right? We got XXY, XYY, XXYY, XXXY, XXXXY, and then we have XXX, XXXX, and XXXXX, right? You know, they fall within the male-female spectrum, but I feel it's important to recognize that there's an entire like world of variations here.
And these chromosomes don't just dictate external physical traits, they have a profound impact on how your body functions, how it responds to diseases, and how it reacts to treatments.
It can.
So how do we as nurses navigate this space? How do we reconcile respecting gender identity with the fact that biological sex plays a crucial role in healthcare?
Well, if somebody comes into your office, like the gynecology office, as a trans woman, and you know they have stuff that you were not expecting going in, first of all, you should know how that stuff works. But if that's not your specialty, then you redirect them somewhere else and say, listen, we need to send you to somebody who's a little bit more specialized in this area. I work more with female genitalia, not male genitalia. That's just how it goes, right? But usually I've never been to a gynecologist, so I don't know, but usually the gynecologist has enough information on like enough know-how as to how like male genitalia works to like help surface level problems. If they need to send you to a more in-depth specialist, then they will.
Let's start with the basics. When we ask about a patient's sex, it's not to dismiss or undermine their gender identity. It is because biological sex directly influences how we diagnose and treat certain conditions. Take heart disease, for example. Women and men often experiences heart attacks differently. The classic chest pain symptoms we hear.
But do you still see how they're still classified into two different categories? Yeah, but if you're recognizing a spectrum, you know, you can say the two main sexes are male and female and there's an entire spectrum between them. There's not just two sexual identities. You have now an entire spectrum of them. It'd be like saying the only colors are red and purple. You know what I mean? That's not true. There's also orange, yellow, green. And then they all fall within that spectrum, but they are in the spectrum nonetheless.
About is more common in men, while women. The classic chest pain symptoms we hear about is more common in men, while women may have more subtle symptoms like nausea, shortness of breath, or back pain.
How much of that is because of like, I feel like if we were to actually look at the data, there actually aren't that many differences between what would indicate a heart attack between a woman and a man, you know, like a male and a female. There's not that many differences. Like they would all have to be sexually related, right? Like, I don't know. That's just me. I haven't looked into it, but I don't think that there are like as stark differences as we once thought.
If we ignore biological differences between the sexes, we might miss critical signs and delay life-saving treatment.
I usually think it's more of a problem when we do recognize that, like, because it works the opposite direction usually, where it's like if a woman comes in and complains of like headaches or nausea or something like that, we're just like, it's just your period. You'll be fine. You know, things like that. I don't know, like I don't remember learning like there's like that stark of a difference between, there are some conditions I guess, but like not very many.
Or consider medication. The way drugs are metabolized in the body often depends on whether someone is biologically male or female. For instance, research shows that women metabolize certain medication like sleep pills more slowly than men.
I believe that is because biologically female people have more body fat, a higher body fat percentage. And so it takes a longer time for those things to metabolize as a result of that. So actually, if you want to, you know, go that route, trans women, as a result of hormone therapy, often have that extra fat, right? That extra fat tissue. And so in that capacity, a trans woman would actually be biologically closer to a cis woman than they would be to a cis man.
Which means they could experience more potent side effects. If we
Exactly, Queen Laura. I think this comes closer to like hormone levels, because it would be hormonal balances that dictate Like hormones have an enormous impact on your body, more so than like, here's the thing. The genetic map is just that. It's like a map. It's a layout, a blueprint, right? But you can override that blueprint. And so if you're overriding it with hormones like estrogen, then your body is going to respond to that estrogen as though your genetics dictated that you produce them. Does that make sense?
Don't take
Good point,
biological
Grimara.
sex into account, we could end up prescribing the wrong doses of.
I think the dose should be prescribed. I've never heard of prescribing something based upon whether or not somebody is female or male. I think that it's more based on their, like how big they are, you know? I think how big they are, sometimes their body fat percentage can come into play, whether or not they're an adult can come into play, but those are the three big ones that I would think of.
Giving advice that doesn't align with how the patient's body actually processes the drugs we give them. But here's where things gets a bit tricky. Gender identity and biological sex don't always align. Someone may identify as male but was born with being biological female or vice versa. That is where our role as nurses becomes even more important. It is our job to respect their identity while still ensuring their medical care is tailored to their biological needs. One of the key ways...
I don't think that I want to give this guy the benefit of the doubt and say that he's coming at this from a good place, but I do feel like this is a little bit condescending toward trans people just as a video, because trans people know this shit, okay? You're preaching to the choir. Trans people are understanding of their biology. What, like, if they're taking hormones, then like their biology changes. They're aware of that. If they're not taking hormones, they're aware that their body isn't the way that it usually they want it to be. You know, like they know what they're packing basically. They know what they're carrying into the doctor's office with them. They're just asking the doctor to fix it. You know, like that's it.
We can do this is through open and respectful communication. It's not about forcing a patient to conform to a binary gender identity. They've chosen how they identify, and that matters deeply. But it's about asking the right question and explaining why certain aspects of their biological sex might influence their healthcare. For example, we might need to explain to a transgender man that even though he identifies as male, if he hasn't undergone the full hysterectomy, he's still at risk for conditions like ovarian cancer.
Yeah, but like they know this. But like they know. But I'm not saying that you shouldn't say you're at risk for ovarian cancer, just so you know. Like, because like this sounds like they're trying to sit trans people down at every appointment and say, oh, just so you know, right? Like I know you identify as a man, but technically you're still female, so you can still get ovarian cancer. Like you don't have to do that at every visit, or even like one of them. They know that. Just tell them, hey, you know, just make sure that you're getting checked for cancer. Do it like you would do with any other patient. Just, that's it. Treat them like you would treat any other patient. You know, it's not complicated.
So all other conditions aligned with the female gender. For a transgender woman, we might need to discuss the ongoing need for prostate exam if she hasn't had surgery to remove the prostate. This can be an uncomfortable conversation for both the patient and the nurse.
But it's not. Okay, no, it's not. Come on. I know trans people. Trans women typically have a prostate. They know that. A lot of them are very well aware of that fact, in fact, and they're happy to have it, okay? Trust me. So, like, it's not... It doesn't have to be, like, this uncomfortable thing, you know? I just feel like we're tiptoeing around trans people. Like, he's doing the liberal thing, you know what I mean? Like, just treat trans people how you would treat anybody. Alec spitting, thank you.
But it is essential. The key is to approach it with empathy and clarity. We are not denying who they are. We are simply acknowledging that when it comes to medical care, some treatments and screenings depends on biological sex.
Yeah,
and
but they
we
know
have
that.
to make sure they understand that this is about their health, not their identity. Another challenge we face is understanding hormone replacement therapy for transgender patients. Hormone replacement therapy is a critical part of aligning someone's physical appearance with their gender.
I'm not really sure what the point of the video really is. I think that he's like I said, I think this is a well-intentioned but misguided video because it just feels like he's condescending trans people. Like, you don't, like, as a healthcare professional, you should not be condescending trans people, okay? They are women or men if they transition to that, okay? They are the gender that they said they are. It's not like, oh, I'm going to respect it and pretend. No. They are man or woman if they transition to that, or other. And non-binary, whatever. Like, they are that identity. That is true, real, factual, period, end of story. That's a fact, okay? If they're having dysmorphia about what they're packing, which I guess is possible, but not very common, okay? Then you have to sit them down and explain, and maybe get the mental health as well and be like, you don't actually have a vagina. You have a penis. But, like, that is so not how trans people actually work. Trans people know what they're packing, unless they have an actual, like, mental health condition causing them to have dysmorphia is what that would be, okay? Dysmorphia. But that's not common. That doesn't really happen. So, like, just don't condescend them. Just tell them what's up. Just tell them what's up. That's it. Just be straightforward and factual. That's it.
Identity. But it's
Yeah, exactly, Queen
also
Laura.
introduce complexities that needs careful management. For instance, estrogen and testosterone have significant side effects on the body.
This is true.
That differs depending on whether someone is biologically male or female. For a transgender woman taking estrogen, we need to monitor for increased risk of blood clots or changes in cardiovascular health. For transgender men taking testosterone, there's an increased risk of certain types of cholesterol changes or liver issues. And again, I want to underline, this isn't about invalidating someone's gender.
But again,
it's
but
about
like,
ensuring their body responds safely to the treatment.
But like, he's still condescending. Like, no, you don't have to do all this, man. Like, this is too much.
Hormones interact with the body based on genetic sex, and we need to manage those interactions with precision and care. So now let's talk about genetic diseases. There are certain conditions that are linked to gender, meaning
sex.
They are directly related to whether a person has an...
Incorrect again. You don't, I usually forgive this, but you cannot conflate gender with sex when you are making a video like this, okay? I would expect better from a healthcare professional.
XX
Points
or an
off.
XY chromosome pair. Hemophilia, for instance, is far more common in biological
You have to monitor for blood clots with cis women on HRT2. That is also true.
males because it is linked to the X chromosome. Color blindness and some muscular dystrophies are also examples of conditions that are more likely to affect one biological sex over the other. If we ignore biological sex when assessing a patient, we might miss these risks or fail to screen appropriately for certain conditions. But how do we do this?
But I don't think that's actually happening. I don't think people are actually ignoring the biologically, like, assigned sex at birth and genetic factors that predispose somebody to a certain condition. Like, a trans woman, as a result of probably being born XY, is more likely to be colorblind, okay, than a cis woman. That is just a variation between them. Like, yes, that's true. How does it feel to share a name with a ding ding dong guy? I guess it's fine. I don't know.
Still showing respect for the person in front of us. It comes down to separating identity from genetics in a way that honors both. We can acknowledge that someone identify as male or female or non-binary or whatever we have of sexes nowadays.
Okay.
While explaining
But
that
again,
the
gender.
genetics influence certain aspects of their health. It's a delicate balance, but it's one that allows us to provide the highest level of care without compromising our respect for the identity of the patient. Because the reality is, healthcare requires us to walk this line, if not every day, then close to. While
But there's just no line to walk here. Trans woman comes and sees you. You say, hey, we got to check your prostate for prostate cancer. You know, you're getting in your 40s. You have a prostate. Let's check you. Yeah. Like, the trans woman is not going to then look at you and say, how dare you? How dare you even bring up the fact that I have a male sex organ? That is disgusting and you're a horrible person. They're not going to do that. That's not a real thing that happens. And like, this video is making it out as though it is. It's like, no, trans women go to the doctor, they get their prostate checked, okay? If they still have it, you know? Like, and most of them still do. So
Gender is a social and personal construct that has evolved over time. Biology remains a constant.
Actually, can you get your prostate removed? I thought you could. Yeah, there's like surgeries for that. Yeah, prostatectomy. Yeah, but again, I'm pretty sure most trans women keep them.
Chromosomes don't change based on how we identify, and neither do physiological processes. But this doesn't mean we can't be sensitive to the emotional and physical aspects of gender identity. In fact,
Why would you remove the prostate except because of cancer? Yeah, I don't know. I mean, if you want it out, then yeah, you can get it out for whatever reason you want. But yeah, good question.
and neither do physiological processes. But this doesn't mean we can't be
Wait, no. Physiological processes do in fact change when you're on hormone replacement therapy. That's like the entire deal there. So this is another misspeak by this person.
sensitive to the emotional and physical aspects of gender identity. In fact, it is crucial that we are sensitive to how someone identifies.
But there's a such thing as being too sensitive, man. You are being too sensitive. You're doing the liberal thing. You're doing the thing where it's like tiptoeing and trying very carefully not to hurt their feelings when all you got to do is treat them as people. That's all you got to do. And I'm sorry I'm getting loud. I know that this is a well-intentioned video, but like just treat them like they're smart, capable individuals. Trans people just want to be treated like they're well-meaning adults like everybody else.
One of the most important things we can do is foster an environment where patients feel seen and respected for who they are. That means using the right pronouns, addressing them
Agreed.
by their chosen name, and by recognizing that their identity is an integral part of their well-being. But at the same time, it means
Agreed.
being honest. Not just about, oh, you are having this disease, but about the role genetics plays in their health. This isn't about choosing one over the other. It's about integrating both to provide compassionate care. And if you want to get smarter on how you can do that,
I agree. I just feel like it was poorly explained.
warmly recommend that you use Mikhail Bakhtin's theory linked at the end of this episode. So make sure you watch all the way to the end and click that link and you will get to an entire playlist with his theory. But let's get into an example. If a transgender
Is there an entire theory on this? I just feel like it's so simple. Maybe it's just me.
patient comes in for a routine checkup, we
Okay.
might start by asking about their overall health, how they are feeling in terms of their gender identity.
I would not bring that up at a general checkup unless the person is specifically, unless the person is still specifically having issues with that. You know what I mean? Like, I would not bring that up. I would just say, how have you been mentally? You know? Like, I see that you're on such and such medication. Like, are you doing okay mentally? Yeah, I'm fine. Ask them the basic, if they have depression, ask them the questions like, are you dealing with suicidal thoughts? Stuff like that. But, I don't know. I just wouldn't bring up their gender identity unless they volunteer it, if you're just at a general checkup.
This shows that we listen and that we care about their experiences. Then we might explain why we need to know about their
Let's put it this way. Would you ask a cis person this question? Unless they bring up something specifically related to being trans and volunteer that information to you, you ask yourself the question, would I ask a cis person this question? I think that's a good standard to have.
that we
Okay.
care about their experiences. Then we might explain why we need to know about their biological sex. And this is because
But at a general health screening, dude, if your doctor is explaining to you at every single general appointment you go to for your health why they need to know about your biological sex, that's weird. Like, you don't need to do that every time, or at all, really. You don't really, when you're first starting out somebody with transitioning, then maybe, but other than that, I feel like this is not, you're almost babying them. I feel like you're babying them. You're just babying trans people.
certain screenings, treatments, or medications depends on it. And by approaching it this way, we make it clear that both aspects are important and that we are not prioritizing one over the other. Ultimately, what we are doing as nurses is providing personalized care. We are not treating people based on generalized assumptions or one-size-fits-all guidelines. We are looking at each individual, understanding both their identity and their biology. And with that, we can tailor our care accordingly. And this is the heart of healthcare, treating people as whole human beings with respect for who.
See, like, he's coming from such a good place. I feel bad dragging the guy, but at the same time, I'm like, dude, if you took care of like half of the trans people that I know, they'd find a different nurse. Like, it's just, I don't know. Like, it comes off as a little weird. It's a little weird.
Power. In Sigmund Freud voice, so tell me about your gender identity.
No, don't do this to me. Thank you for another 5-tier ungifted sub, Saga Tanuki. I appreciate you very much.
They are, and the biology factor that impact their health. And this is not only, well, when it comes to transgender, it is when it comes to everything healthcare. But when it comes to respecting gender identity in healthcare, it's about the balance. We can honor how a person identifies while also recognizing their genetics, and as I promised you, the Michael Bacte's theory will help you do that, and this entire playlist that will take you deep into this theory, so I warmly recommend that you check this one out.
I don't know. The guy clearly means well, but again, it's just a matter of being like condescending. Yeah, it didn't help at all. Like, just treat trans people like you would treat anybody else. Like, it's really not that hard, guys. It's really not. Just like say, oh yeah, you're a trans woman, great. That means that you got, you know, you go like, let's say that a trans person's having problems with their genitalia. You know, they go into their general physician, their family nurse practitioner or whatever, and they say, you know, I'm having issues down there. Can you take a look? You know, like, you don't have to sit and explain like, okay, I'm going to look at your penis now because you're a trans woman. And that means you have a penis down there because you haven't had bottoms. Like, come on. Like, that's silly. Okay. Just treat them like a normal ass adult. It's not that hard. Hey, thanks for watching. If you enjoyed the video, please be sure to hit the like button, subscribe if you want to see more, hit the notification bell to be notified when I upload. If you enjoy my content, you enjoy what I do, I really appreciate any financial help that I can get. Go to youtube.com/AlecGunterTTV/join. You got some awesome benefits such as seeing early videos, awesome emotes that you can use in the comments of YouTube videos, and a sweet badge next to your name. So if that sounds interesting to you, I'd really appreciate if you join. It is cheaper than the cost of a blowjob from your mom. So with all that being said, thank you again for watching, and I'll see you all in the next video.